Great. So for the next part of the exam, I'm gonna actually have you take off the gown. I'm just gonna examine your breathing. Great, you can relax. Okay. You haven't noticed any pain or anything like that? Okay. So what I'm gonna have you do for this part of the exam is I'm just gonna have you say 99, 99, 99 over and over until I tell you to stop, okay?
99, 99, 99.
Okay, you can relax. Perfect. So I'm gonna apply some pressure, okay? No problems with that. Okay. Next, I'm going to take a listen real quick, okay? Deep breath. Good. While we're here, I'm going to have you say 99.
99, 99.
Perfect, you can relax. Say E for me.
E,
Say 99.
99,
Say E.
E.
Great. Just listen to the side. Deep breath in and out. Say 99.
99,
Say E.
E.
This side. Deep breath in and out. Say 99.
99,
Say E.
E.
Perfect. So next I'm going to have you actually turn around for me. For this part, I'm just going to place my hands on your back, and I just want you to take a nice deep breath. And one more time. Great. You're not having any stomach problems when you take a deep breath, are you?
Nope.
Okay. Great. So again, I'm just looking at your back, you're breathing. I want you to do the same thing. You're going to say 99, 99, 99, okay?
99, 99, 99.
Great. Next, I'm just going to apply some pressure. So I'm just going to listen. Deep breath. Deep breath. Deep breath. Say 99
99,
and say E.
E.
Deep breath. Say 99
99,
and say E.
E.
Thank you. You can come back down around. So for the next part of the exam, I'm going to place my stethoscope. I'm going to whisper a phrase to you. I want you to repeat back 1, 2, 3, but nice and soft, okay? Say it.
1, 2, 3.
And again.
1, 2, 3.
And again.
1, 2, 3.
And again.
1, 2, 3.
And if you can turn around one more time. And again.
1, 2, 3.
And one more time.
1, 2, 3.
Great. Thank you. And you can just sit, lay on the bed for me. So for the next part of the exam, I'm going to take a look at your heart, okay? I'm just going to lay you down. Right here. I'm just going to look at your neck. Okay, great. Next, I'm gonna have you lay on your left side and put your left hand above your head, okay? You haven't noticed any pulsating in your abdomen or anything like that, have you? Right, you can sit back up. Just gonna take a listen to your heart. So just relax, just breathe normal. Lean forward for me. Okay.
Do your respirations. So I'm going to listen to or palpate your radial pulse. In this part, I'm actually going to be watching her respirations for 1 minute. Okay, a minute has passed. Can I have you breathe in deeply for me? And exhale. Perfect. And can you cough for me? Perfect. I am now going to listen to your lungs on the front. And I'm going to be listening to it in the back. Okay. Now I am going to move on to the cardiovascular section. I am going to listen to the apex of your heart. Okay, now I will listen to the apical pulse and your radial pulse. Use this hand. Thank you. I'm palpating the radial pulse and listening to the apical. For 1 minute. Okay, now I'm going to listen to your heart. Okay. Now I'm going to check for your capillary refill. I just want to check some more. Okay, and I'm going to do V2. Perfect. Okay, now I'm going to check for peritibial edema. So if you don't mind, could you sit side face for me? Thank you. I'm gonna look at it bilaterally. Okay, now I'm gonna look at your posterior tibial and your dorsalis pedis pulses bilaterally. Okay.
Is we're going to inspect or assess your thorax and your pericardium. So what you would want to do is you're just generally assessing the patient's breathing. So I'm going to have you just take some nice good deep breaths in and out. So you would want to make sure that the patient's breathing is symmetrical bilaterally. I'm going to have you stand up really quick and just face that wall. So you would want to assess the patient's chest and then raise both arms up for me. And then you're also going to assess her AP diameter. You can bring your arms back down, which her AP diameter is half of her chest, so that is normal. That's exactly what we want. The next thing I'm going to do is assess for any spinal deformities, curvatures, anything like that. So I'm going to lift up your shirt, and then I'm going to have you just bend over, touch your toes, and we're just basically looking to see if you have any curves in your spine. Okay, looks good. Okay, you can stand back up. Okay, awesome. Sorry. So she has no thoracic deformities noted. Now I'm going to have you just sit right back down on the bed. The next thing that we're going to do is, this is when you would just assess like patient's radial pulse and respiratory rate. Normally you would palpate the radial pulse for a full minute, but for this purpose we're only going to palpate for 30 seconds and we'll multiply by 2, and the other half of it we can assess the respiratory rate. You wouldn't tell the patient that you're assessing their respiratory rate because it might change their breathing pattern, but for this we're going to. So. So your heart rate was 80 and your respiratory rate was 16. So the next thing that we're going to do is we would just palpate the patient's chest. We want to start on the front. You want to start up in the shoulder area, and you're just basically palpating the muscles and intercostal spaces to make sure, hold your arms at your sides for me, to make sure that everything is symmetrical and normal. Sorry, hands are cold. Okay, all the way through every single rib. Then what we're going to do is I'm going to place my hands underneath your chest and we're going to measure chest exertion. So I'm going to have you take nice good deep breaths in and out, and you just want to watch your thumbs move symmetrically apart. Okay, very good. Okay, so now we're going to do the exact same thing on the back side. We would just want to palpate all the way down, all throughout all the ribs. Then we're going to come back, and once we get to about the 10th rib, we're going to place our hands exactly the same way except on the back side and do chest exertion back here, so nice good deep breaths. And my thumbs are moving equally bilaterally, so it's symmetrical. Very good. Okay, now I'm going to assess for tactile fremitus. So I'm going to place my hands on your back, and I'm just going to have you say 99 a few times.
99, 99, 99. 99, 99.
Okay, perfect. So the next thing that we're going to do is we're going to do some percussion on the back. So when we percuss on the back, we're wanting to percuss to make sure that we're hearing normal sounds. We're going to percuss about 10 spots on the back to start out with, and you would want to start at the left upper or up high, and you want to work left to right systematically. So. perfect. The next thing we're going to do is we're going to percuss lateral chest, so I'm going to work side to side. You would want to do this in a systematic manner too. Also, you want to do 4 spots on each side. So. Okay, perfect. Everything sounds normal. Finally, we're going to do the front last, okay? So we're going to do the exact same thing that we just did on the back, except we're going to do it on the front. We're going to want to start just above the clavicle. So here we go. Okay, and everything sounds normal. So the next part of the assessment, we're actually going to auscultate the patient. We're going to auscultate in the exact same spots that we just previously did. We're going to listen with the bell of the diaphragm of the stethoscope first, and then you would listen with the bell. For time purposes, we're only going to listen with the diaphragm. So I would have the patient take nice, good, deep breaths in and out, and I would want to listen 10 spots posteriorly, 4 spots each side laterally, and 8 spots anteriorly. So if you'll just continually give me nice, good, deep breaths in and out, Tara. Okay, we're going to work around to the front. If you can place both arms at your sides, I'm just going to listen to you laterally. Okay, and then we would just listen to the front in the exact same demeanor. Okay, so for the next part of the assessment, actually we're going to do one more thing on the back side really quick I forgot to do. As I auscultate in the back, I'm going to have you say 1, 2, 3 over and over and over. And this is the whisper pictorially test. So
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
okay, perfect. So for the next part of the assessment, we're actually going to assess the patient's heart sounds. So what you would want to do is there's 5 standard locations that you want to auscultate with the heart. So the most important spot is the mitral valve or apical spot, which you would want to listen to for a full minute whenever you're auscultating. But we'll get to that spot here in just a little bit. So there's landmarks for every single spot. So the first one we're going to find is the aortic area, and that is on the right side of the sternal border, the second intercostal space. So you would palpate down intercostal spaces. I'm going to have the patient take a nice good deep breath in and hold it while I'm listening. Okay, you can release. And at each spot, you're going to want to listen to S1 and S2. If you hear any other abnormalities, you can go further with your exam. The next spot we're going to listen to is the pulmonic area, and that is on the left side of the sternal border, just directly across from where we were at, the second intercostal space. So again, I'm going to have you just take a nice good deep breath in and hold it. Okay, good. Now we're going to move down another intercostal space, so we're going to be at the third intercostal space. This is the second pulmonic area, and we're going to, so the third space down, but the second pulmonic area, a nice good deep breath in and hold it. Okay, then we're going to go down another intercostal space, which would be the tricuspid area, and it's just left sternal border again, so a nice good deep breath in and hold it. Okay, and then our fifth spot, we're actually going to go fifth intercostal space down, left mid-clavicular, so you're going to move more midline on the left side. And this is the mitral valve or apical area. You would want to listen for a full minute here and then reveal the heart rate, but we're not going to listen for a full minute. We'll listen for about 30 seconds, so for time purposes. Okay, heart rate is 68. So now we'll move on to the next part of the assessment, and that will be palpating peripheral pulses. So what we're going to do is we're actually going to start with the carotid pulses. You're going to want to palpate one at a time because you don't want to palpate them both at the same time. So we'll first find the one on the left, easy to find, then find the one on the right, easy to find, and they're both +2. And then you're going to want to listen with the belly of your stethoscope for the carotid pulse to make sure there's no abnormalities as far as bruits. And none are heard. Then we're going to move on down and we're going to do the brachial pulse. So if you can extend both arms out, you're going to find one at a time. Brachial pulses are on the inner aspect of the elbow. If you basically follow the ulnar bone straight up, they're just right in here where the arm bends. Okay, good. Good, and hers are both +2. Next, we're going to move on down to the radial pulses. This would be another good opportunity to palpate the radial pulse. You would palpate for a full minute, but we already know her heart rate multiple times during this assessment. Okay, and those are both +2. So now I'm going to have you lay flat for me. I'm going to assess your femoral artery pulse, which is very low down. It's basically near the mons pubis, where the mons pubis area meets the groin. So you would just lightly palpate. And the femoral artery is usually +2 to +3. It can be stronger than the other pulses, and hers are easy to find. Okay, good. So now I'm going to have you roll over and I'm going to assess your popliteal pulses. So if you can lay on your stomach, you would lightly bend the patient's leg up, place your fingers in the popliteal space, and just feel for the pulse. Okay, good. Now we're going to just do it with the other leg. Okay, good. Okay, you can roll back over, and if you want, you can stay in a laying position because I'm going to do the pulses in your feet. Both the popliteal pulses were +2. So next we're going to go for the posterior tibs. These can be a little bit more difficult to find. They're on the inner aspect of where the heel is. And hers are actually very easy to find. Okay, and then we're going to go for the dorsalis pedis. Okay, good. Good. Both.
I'm going to check the anterior chest now. So I'm going to start with the skin. It is appropriate for your ethnicity. I don't see any lesions or marks or scars on it. Your breathing looks even and unlabored. I'm going to check your costal angle, so if you'll take a deep breath for me. Good. It's 45 degrees. Okay, so we're going to start with your aortic, but I just need you to breathe regularly for me while I'm listening to these, okay?
All right.
So we're going to start right here at the aortic. Okay, pulmonic. Second pulmonic. Tricuspid. Mitral. And epigastric. Okay. Flip my stethoscope around. Okay, good. S1 and S2 sounds are present. I didn't hear any murmurs or any abnormal sounds. So now I'm going to move around. I'm sorry, I'm going to do your lung. I'm going to listen to your lungs on the front before I move to the back side.
Okay.
So if you can just take a deep breath for me every time you feel my stethoscope. Okay?
Okay.
Okay. So the vesicular sounds are up here. Okay. And I did listen to your bronchovesicular sounds right here beside your sternum, okay?
Mhm.
All right. So breath sounds were clear. I didn't hear any wheezing or crackles. So we're going to go ahead and move to the posterior side, okay?
All right.
If you could, yep, turn for me.
Okay.
So I'm going to start with checking your spine. It is straight. There's no curvature. If you could raise up your shoulders for me. Good. And back. Good. Scapula is even. Skin looks even, appropriate for your ethnicity. I don't see any lesions or scars or anything. So now we're going to listen again. So if you'll just take a deep breath every time you feel my stethoscope again, okay?
All right.
All right. And the vesicular sounds are up here. Okay, and then we got your bronchovesicular sounds. Okay, good. They were clear back here. I didn't hear any wheezing or crackles.
All right, now I'm going to listen to your heart sounds. First, I'm going to be using the diaphragm, which is this big part, and this is for high-pitched sounds. So I'm going to start right sternal border, second intercostal space. And then I'm going to move to right sternal border, second intercostal space. This is your pulmonic area. What I listened to first was your aortic area. And now I'm going to drop down to left sternal border, third intercostal space, and this is Erb's point. And I'm just going to come up underneath your shirt. And then this fourth intercostal space, left sternal border. This is tricuspid area. And then I'm going to move mid-clavicular line in this fifth intercostal space. And this is the mitral area. I hear clear S1, S2 sounds with no adventitious sounds or murmurs or clicks. And then I'm just going to do the same thing with the bell of my stethoscope, which is going to be for low pitch sounds. Starting in that aortic space again. Pulmonic. Erb's point. Tricuspid area. And this mitral area. No bruise. Again, just clear S1, S2 sounds. No extra hard sounds, murmurs, or clicks. Now I'm going to be looking at your chest while you breathe. I see that it raises symmetrically, even and equal bilaterally. I see that you're not using any accessory muscles when you breathe. And now I'm just going to be listening to 6 spots on the front of your chest for your breath sounds. If you would take a deep breath in and out for me each time I place my stethoscope. I'm going to come up underneath on this side. Alright, and if you would turn and face this way for me, and I'm going to listen to 8 spots on the back. Gonna come up underneath your shirt. Alrighty, I hear no adventitious sounds over all lung fields on the front and the back of your chest. Now I'm just going to be assessing some pulses. So I'm going to start with your brachial pulse, which is in your elbow. Alright, and on the other side. I see 2 plus out of 4 equal bilaterally. I'm going to move to your radial pulse, which is in your wrist. Actually, I'm going to move this. And another one. 2 plus out of 4 equal bilaterally. If you would lay down for me, please. And I'm going to be feeling in your groin area for some femoral pulses. Two plus out of 4 equal bilaterally. And now I'm going to feel for some inguinal lymph nodes. Do you feel any tenderness? No. No enlargement. And now if you would kind of bring your knee up to your chest, I'm going to feel your popliteal pulse. Now drop all the weight on your foot. And then again, we're going to do this on the other side. Lift your knee up, drop your weight. Now I don't feel your popliteal pulse, but in this situation, I would go get another nurse to help me. And if you would, go ahead and sit up for me. I'm going to raise this back to a 30 to 45 degree angle. And if you'll lay back for me, I'm going to use my pen light. And if you would, look to the right side for me. I'm just looking for your veins. I see that it's flat, so no JVD on this side. And then we're going to move to the other side. Again, flat, no signs of JVD.
I'm going to do a couple tests on your back so you can swing your legs around. So I'm just going to feel around. Any tenderness here? No. And can you take a deep breath in for me and out? Good. Any cough recently at all? Any chest pain? No. Okay, good. When you feel my hand on your back, can you please say the word 99? 99, 99, 99, 99, 99, 99, 99, 99. Just move your head to the side. Thank you. gonna take a listen, and when you feel my stethoscope on your back, can you please just take a deep breath in and out through your mouth. I'm just gonna lift this up, okay? You feeling okay? Any lightheadedness? No. Okay. Good. So everything sounds nice and clear, so you can swing your legs back around. And we're going to do the same things that we did on the back but on the front. So you feel around. Any tenderness? No. Again, when you feel my hand, can you say the word 99? 99. 99. 99. 99. Good. Listen. Again, when you feel my stethoscope, can you please take a deep breath in and out through your mouth.
Alrighty, so we're going to move on to listening to your heart. I'm just going to be listening in multiple different areas. If you have, you can breathe normally, but there's not, I'm just making sure that all your valves are heard, okay?
Okay.
I did notice that there were no heaves, lifts, or pulsations, and I'm going to go before I do that, I'm going to check your angle right here, so I'm just going to move this right here. If you'll breathe in and out for me. Alrighty, and that, it was at a 45 to 90 degree angle, so, and there was a elliptical shape, good even slope.
Okay.
So, move on to listening. Make sure this is on the correct side. Alright. We're at the second intercostal. S1 and S2 are present and regular. That is the aortic region. This is the first pulmonic. Second pulmonic. Tricuspid. Mitral. And epigastric. Perfect. We'll switch this around and we're just going to listen again, okay? Alrighty. Go ahead and switch this around before I forget. Everything sounded normal. Now we're going to go ahead and move on to your lungs, okay? So every time that I move my stethoscope, just take a deep breath in and out, in through your nose, out through your mouth, okay?
Okay.
All right, there's going to be many different areas that I listen to, so if there are any, if you need to take any breaks, just let me know.
Okay.
Good?
Mhm.
Okay. All right. Listen right here. And these are just the vesicular breath sounds. those are more of the bronchovesicular sounds. And we'll go back down here. Nope, I'm gonna go here first. Do it again. Thank you. And right here. Good. We're gonna go on your side. And this side. Again, one more time. Good. Those were more of the vesicular sounds as we went down. Okay. Alrighty. And if you will turn so we can do your back. Put my leg up against your leg so that way you're stable on the bed, okay? Okay. Alright, again, we're going to do the same thing. Deep breath in and out every time we move my stethoscope. And if you need to stop, just let me know, okay?
Okay.
Before I do that, I do want to go ahead and check for your scapula, the edges of your scapula. And I'm also going to check, if you can lean forward for me just a little bit, your spine alignment. And then we're also going to check your chest extension, okay? Okay. So if you'll deep breath in and out for me. Great, and there was symmetrical movement along those as well. Okay, now we're going to listen.
Okay.
Deep breath in for me. Go on your side, right here. Same spot on the other side. And down one. And one more. Right there. In and out. Good. Alrighty. If you want to flip back around for me. That was all good. Okay.
Inspection. So we're inspecting the general appearance of our patient, so everything looks appropriate. He's not any signs of distress, right? His breathing is easy, it's controlled, non-labored. His chest is symmetrical, it's rising and falling symmetrically. We don't see anything out of the ordinary. Another thing is we can take a peek. As we look to the side, we look for something called barrel chest, which he doesn't have. He has a normal AP diameter, so the anterior and posterior diameter. Everything looks normal. We don't see any lesions. We don't see any abnormalities. And then the next thing too is we can just inspect the skin as well. The skin is cool, it's dry. Then we take a moment to look at the face. We look for any type of cyanosis in the lips. Okay, jaundice too, you can look for things like that. Another thing that we can take a look too while we're inspecting is for any signs of edema. So edema can take place in the upper and lower extremities bilaterally, so on both sides. It's mostly in the areas where, gravity and blood pools, right, related to gravity, so in our feet. It doesn't look like he has any edema anywhere. Everything is within normal findings. Another thing too is we can look at the fingertips, right? We're looking for any type of clubbing. So that's basically almost like a spooned appearance, and that happens with periods of hypoxia, especially in patients who have like chronic obstructive pulmonary disease, smokers, things like that. So we don't see any findings there. So the next thing that we can move forward to is doing percussion, or we can do palpation. So what we would like to do first is we'll start with the anterior aspect, just because I am facing him. So I'll have you lean back a little bit, and you can just relax, lean back in the chair, relax. And then we're gonna start with percussion first. So we're just gonna percuss over the interior areas, right? We're making sure that everything's within normal findings, right? We're going over equally, side to side. We shouldn't be hearing any dullness over the lung tissue. And moderate. And opposite. Okay, so everything sounds resonant, which is a normal finding, right? We'd only expect to hear dullness if you're going over like muscle or any type of dense tissue like liver and things like that. Another thing that we can do too, since we're in this area, is we want to also check for the point of maximum impulse, right? So, or the mitral valve we can also refer to this. Okay, we can feel it here. It's good, it's present. It's not bounding, it's normal. Okay, the next thing we can do too for palpation is we can check our capillary refill, right? So this is where we just apply a little bit of a pressure, and then we see how long it takes for the fingertips or the capillary beds on the fingertips to return to its normal color. So we want a finding that's anything less than 3 seconds. This is about 2 seconds. So that's a normal finding. Perfect. And then another thing that we can do too is at the same time, since we're already down here, we can just check for our radial pulse. Okay, it's equal bilaterally. I would say it's about, I'd say about 3+ bounding, but this is good, this is normal. The next thing we can go to is our brachial. Okay, I would say this is about a 2+, equal bilaterally. So 2+ would be like an expected finding. The next one that we can go to, since we're palpating, would be the femoral, but for this one I'm not going to show it, but the femoral is going to be more so in the groin area, so we're not going to show it for this one. Next we're going to move down and we're going to go to the popliteal. I'll just have him elevate his knees on here, if you can just do both. So this would be behind the knees. Say about 2+, so expected. Next ones that we can go to is posterior tibial pulses. Okay. And right here, I don't know if you can see it. It might be a little bit hard to see, but it is equal symmetrical, about a 2+, so expected. And then the last one we're going to do is on your feet. So this is going to be the pedal pulses. These are going to be really important in our patients who are like diabetics and things like that nature. You can't really see both feet. I'm sorry for this. So we'd right about here in between the big toe and the second toe. I usually ask them to flex their foot, and it's going to be right between this arch. Okay, it's present. Now with the pedal pulse, you just have to be really careful because you don't want to press too hard because you can occlude it. So for those, it's equal symmetrical bilateral, about a 2+, so expected findings. So now we went through the whole interior aspect of it, both the respiratory and cardiac, inspection and palpation. So now we're going to go to the back. We're going to go to the posterior aspect of it. So I'm going to, now go to percuss his back and also taking a quick look at it as well. Okay, so we're going to do the same thing. So what I'm going to have you do is lean forward, cross your arms, almost like a tripod position. Okay, perfect. Spread the scapulas. Perfect, better. Okay, and you can come a little bit forward just so you can see better. Okay. Perfect. Okay, so next, inspect. I don't see any types of scoliosis. The spine is symmetrical, it's even, nothing out of the ordinary, no abscesses, no disfigurement. The skin is nice and cool to the touch, no sweating, everything within normal. So now we're going to go into percussion, okay? Okay, and then next we're going to go into the lateral aspect of it. Okay, might be a little hard to see from this angle. You're okay. Okay. Okay, everything sounds resonant. I don't see any type of dullness in any of the lung tissue areas, right? So a next thing that we can do is something called the diaphragmatic excursion, and just because of, you know, anatomy, we want to, you can hear it best on that right side, right? Because unfortunately the liver and things like that, so the diaphragm actually rests a little bit higher on that right side. So we're going to start on our right side. Is what we'll do is we're going to ask you know, the patient to take a nice deep breath in, hold it, and then we're going to percuss, usually starting at the scapula, the second intercostal spine. Okay, you can breathe. Okay, so about here. So we're really checking for about, like, it should be within, I believe it's 3 to 5 centimeters, right? So we're checking from where the diaphragm rises to when it falls. And that change from dullness to resonance is going to signal that. So everything is within normal findings as far as our inspection and our palpation as well as our percussion. So that looks good. So the next thing we can do too is I'll have you lean forward again. And then we can also, since we're back here, we're going to listen to our lung sounds. So if you can just spread that scapula. Good. And I'm just going to move this so you guys can get a better view. Okay, and every time you feel my stethoscope touch you, take a nice deep breath in, okay? And then also too, while we're back here, we can just take a listen to the lateral lungs too. We're almost done. And one more side. One more. Okay, good. So I just want to add, there's one thing to also consider. So this back has a lot of dense musculature, so you have to kind of position a little bit better. So this wouldn't be like, you know, the equivalent to someone's normal back. So for him, I had to go a little bit closer just because over this musculature, you're not going to hear the best sounds. Another thing you also have to consider is on the posterior aspect when you're auscultating, you'll hear any type of adventitious lung sounds, usually in the lower lobes, this area here and here. Another thing too while I'm back here that I also wanted to do is I'm going to ask you to take a deep breath. And we're checking for chest expansion. You can't see it too well, but really what we're doing is we're having both fingers around their chest and we're watching to see our thumbs move and separate. That's going to be checking for that equal rise and fall of the chest, and then also its expansion of the lungs and then it collapse of the lungs. But everything's within normal findings. So that concludes the posterior. Then we're going to come back and finish everything that we need from here. Then we're going to go to the anterior, so the front position. And as far as the lung sounds, no adventitious lung sounds. Everything was within normal findings, expected for a young, healthy young man. Okay, so next we're going to listen to everything. So this is going to be the heart sounds. Before I move forward to another thing, you could also take a look at their trachea as well. So we would check right here, trachea, this is the substernal right here, and then the trachea is usually right about that notch. Check for any lumps, that's good. That's also included in my, my neck and throat video. Another thing too is we can check our carotid while we're here as well. Never at the same time. If you do them at the same time, you can cut off blood flow to the head and you can make that person pass out. So you don't want to do that. One at a time, always. All right, so we're going to start by listening first. I'm going to start working my way from head down. So we're going to take a listen first with the belt, right? To listen for any bruise, any thrills, things like that, turbulent blood flow. Okay, nothing abnormal, which is great. And now we're just gonna, you can just relax. I'm just gonna be listening to your heart, okay? I'm gonna move your cross. So we're going to second intercostal space. So this is our apical. So aortic valve, pulmonic valve, second intercostal space, third intercostal space, tricuspid valve, excuse me, it's going to be, so it's atrial, pulmonic, Erebus point, and tricuspid, then mitral valve, fifth intercostal space, midclavicular airline, and this is going to be our mitral valve. This is going to be also the point of maximum impulse. Another thing while you're doing here, you can also take a finger, palpate the carotid. At the same time, you're looking for that equality in both beats, so you're listening and then you're feeling, you're making sure that they're symmetrical, right? So that's going to signal S1 or that glub. Okay, everything's good there. Another thing too, if you really wanted to, you could also palpate his abdomen, and that's when you can, feel for any type of abnormalities, right, in the abdominal aorta. You can also give it a listen too. Okay. And then last thing is you can also ask the patient, usually they would be in some type of, bed, or they're going to be on the examination table. But in this case, he's in the chair. So I'm going to ask you to lean all the way back in the chair. Look at me. And then we're going to be looking for any jugular vein distension, right? JVD. And what does that signal? If there's anything out of order, that's going to signal maybe some type of like heart failure, something's going on, some type of backflow. So there's, as far as our interior aspect, listening, auscultating lung sounds from this point, and then also heart sounds. I don't hear any type of murmurs, no thrill, no bruise. Everything's within normal findings. This is a healthy young male with good vasculature.